Prevalence of malaria in the country has reduced from 8% as recorded in 2015 to 5.5% last year. This is according to the nationwide population level assessment on the burden of malaria in Kenya, dubbed the Kenya Malaria Indicator Survey 2020. The preliminary report released by the Ministry of Health showed that the cases and admissions of patients suffering from the killer disease had also significantly reduced, as Ruth Mulandi now reports.
As the world marked the World Malaria Day, the Kenyan government, through the Ministry of Health, says it has made significant progress in the fight against the leading cause of mortality in the country, with the disease now listed among top 10 causes of outpatient visits countrywide. But despite these statistics, the country seems to be on the right path in fighting the killer disease. According to the preliminary report of a nationwide population level assessment on the burden of malaria conducted last year, the overall prevalence of malaria in the country reduced from 8% as documented in 2015 to 5.6%, where the Lake region, which bears the highest disease burden recorded, are reduced prevalence rate from 27% to 19%. The Coast region also recorded a drop from 8% to 4.5%, with the proportion of patients seeking out and inpatient services reducing from 30% to 19% and 20% to 15% respectively.
But as we celebrate the gains, we must not lose sight of the ball in our concerted efforts to defeat this disease once and for all. We plan to scale up our current efforts, introduce new strategies, and apply lessons from countries that have recently eliminated malaria.
It is through these gains also that the Ministry of Health launched a campaign